Hi, everybody. Hello. Good evening. Welcome. Oh, looks like we have a little feedback issue. See what's going on. Testing, testing. Okay, that's much better. Our folks on Zoom, are you able to hear us well? Okay, I see people joining. If you want to just put in the chat, let us know that you can hear us. Thank you. Well, thanks so much for being here tonight. How many of you is this your first time to this event? Oh, lots of first timers. Thank you so much for being here. We started this event, this series about 10 years ago. It was really a way community into Roseman and have Roseman connect more with the community and better understand the kinds of topics, healthcare topics that you wanted to learn more about. So just a couple of logistical things. We are recording this. We post it to our Neighborhood Health Series page so that all those recordings can be accessed by people that miss it or want more information and things like that. At the end, we'll take questions and we will have you hold the mic in order to have your question heard. Even if you have a loud voice, our recording cannot pick you up unless you're actually holding the mic. So we'll get to that at the end. Real quick, some of you know we're celebrating some amazing milestones here at Roseman. The beginning of our College of Medicine. I'm always happy when we have students here, so I want to acknowledge Lucy in the back. She's part of our inaugural cohort. There she is, Lucy. Great, thank you. And we are also in the process of establishing our College of Veterinary Medicine. So I also would like to welcome Dr. Catherine Fogelberg. She's back there. She is our founding dean. So we're really excited to have her. And also this campus, which many of you have become accustomed to, is really in a state of change. So all of the land that you see down here that goes along Twain, in the next 3 to 5 years, you'll see a lot of changes with that being built out. And this whole campus built out, and ultimately many of our students that are in Henderson moving over to this campus. So very, very exciting time for that. So with that, I'd like to get started and introduce someone very special. This is Craig Fraley. He's from Clark County Credit Union. Clark County and Craig have been faithful supporters of the series for so long. They enable us to put this on and provide all of our dinner. And for that, we're very grateful. And for that, I'm going to just turn it over to him very quickly.
I don't have any questions. Good evening, everybody. We are the Medical Field Credit Union. We are very proud to sponsor Roseman's Neighborhood Health Series. And even though we have the charter for medical, anybody can join the credit union. I put some magazines out on the table out there. Somebody's already grabbed one. Very good. Don't wait for the movie to come out. It's a good read. And why would you want to join Clark County Credit Union is because we're owned by our members. We are not for profit. We have some of the highest deposit rates in the country. We have a checking account that pays over 4%, highest in the country on a checking account, which is amazing. This year, we've given our members have earned back over $35 million in dividends. It's an awesome place to bank. Check out our website, and you can see all the great features we have. Enjoy tonight's presentation. Thank you, and have a wonderful evening.
Thank you, Craig. Okay, I'd like to introduce our very special guest tonight, and I'm going to try not to get misty-eyed as I read this, but Stephanie Gerken founded Michael's Angel Paws many years ago, and it always is so moving to me that people that experience significant trauma in their lives can come through and start something so amazing that gives back to our community. So she is really a personal hero to me. She also loves dogs as I do. So I am so grateful to have her here today. And I want to tell you a little bit more about her. So Michael's Angel Paws is a 501c3 that strives to make a difference in the lives of individuals and the community through the hope and magic the dogs can bring. They're a team of passionate dog lovers who believe that the bond we share with our dogs is everlasting. Through their different training programs, Michael's Angel Paws will help enhance the relationship with your four-legged best friend to help you live a life of love and adventure. On September 13th, 2011, she welcomed their angel, Michael Charles Gerken, into their lives and our hearts. They didn't take for granted those precious hours spent with Michael that night. Having been blessed with a son for a few short hours made a tremendous impact on their lives. They'd chosen to remember this day, not as his birth or death, but as the day he became their angel. As she recuperated medically and emotionally, she was determined to not let Michael's brief time here on Earth go unnoticed. She knew that if he had survived, he would have needed a service dog to help mitigate his disabilities, and as a mother, she would do anything to help him. Michael's Angel Paws was founded on and is dedicated to helping our communities and ultimately their commitment to helping others positively every day, or hope. In her many years as a leader in the canine community, she would often overhear the word hope. She was able to take that inspirational word, the legacy of Michael, and with the tremendous love and support of her family, to found the organization to help those who want a better quality of life from a service dog. Pretty incredible. Yes, definitely. And not to be overshadowed by our amazing Dr. Arup Chakraborty, Associate Professor of Pharmaceutical Sciences. Dr. Chakraborty received his Master of Science in Biological Sciences and a PhD degree in chemistry from the University of Nebraska, Lincoln. His MS and PhD thesis was based on the regulation of protein synthesis in mammals by protein glycosylation and phosphorylation. The central focus of his postdoctoral training at the University of Pittsburgh Medical Center was on the role of inflammatory cytokines G, CSF, IL-6, and IL-3 in blood and normal blood cells in leukemia. He received 2 grants from NIH and the Laurie Strauss Leukemia Foundation during that time. Then he joined as a tenure-track assistant professor of medicine at the Baylor College of Medicine in Houston. He studied the role of cytokine receptors during inflammation and the aberrant existence of them in the bladder and pancreatic cancer. He established the hypothesis that cytokine and its receptors can serve as an early biological marker for the poor prognosis of cancer. He has he has published widely and has many awards. And with that, please join me in welcoming Dr. Arup Chakraborty.
First of all, thank you for such a kind introduction. I would like to establish that am I shouting? Or hearing? Okay, great. Because it's a small room, it's too loud. So anyway, so I am teaching in Roseman University College of Pharmacy, roughly 15 years. I teach biochemistry, pharmacology to PharmD students. I also teach in orthodontics program, where I teach the pressure biology, when you create a pressure on teeth, what kind of signaling happens and how that helps to remodel. I also teach 1 day or 1 or 2 days in graduate studies too. So beside teaching, I also have big fascination about AI. So today I'm ready to accept any question that you stop me and you can ask, because I'll go very in a relaxed speed. Okay. Number 1. Number 2 is at the end, I'm going to show you AI generated video on diabetes. So my talk is going to be divided in a 3-part. First, I'm going to explain what is diabetes. Secondly, why we need to treat them, and what is the cutting edge treatment options are available. So if you want to, it's not going to cover everything, but feel free to stop me and ask any question that you might have. But remember, if I hear your question, I have to repeat it because we are recording the whole talk. So why you would like to talk about diabetes? Because 37 million Americans, it's not a joke. It is not a joke. We have to start talking about diabetes, and I'm going to tell you like why it is like going spreading so rapidly. And the good news is like it is really not preventable. It's a little bit strong word. I would say manageable. It is definitely manageable. But our major problem is we don't understand the disease properly, and the symptoms are, there is no major symptom of the disease. So we have a tendency to overlook. And that's what I'm going to establish today, that you'll understand, like we have to be proactive. It's not like by the time like we are diabetic, it's already too late. So what is exactly diabetes? The first question. In one sentence, if I have to say like what is diabetes, it is insulin malfunction. Either insulin is not present in my body because the cell in my pancreas that produces insulin, they are dead, and I will be called type 1 diabetic. Or in my body, I am producing insulin, but it is not enough. It may be like a secreting low level. Now, that is still okay, because insulin, like a first one, there is no insulin, you apply insulin, use insulin pump, pretty much they live a normal life if they take it. If I'm secreting less insulin, I can also take extra insulin to make it up. The third type, basically it's called type 2, which is like a maybe low, or insulin is not functioning properly. That is the major challenge. Now, you should not think like that type 2 diabetes is like a one disease. It can be different. So it is important to understand that what is happening in my body. Based on that, we should develop the treatment strategy, and that I'm going to establish today. Now, what insulin does? First, insulin is a hormone that secretes from our pancreas when normally when we eat carbohydrate, then the glucose level in our blood goes up, and that triggers the first wave of insulin secretion. There is a two wave. What is the second one? That is important. I'm going to cover that one later on too. When we eat carbohydrate, when that hits our intestine, that also triggers two hormone secretion from our intestine. They are called GLP-1 and GIP, two hormones. Remember that, because I'm going to come back to those function of those hormones and how we are using that one. So what insulin does, the major function of insulin is to promote glucose entry in our muscle. Muscle, they are the major consumer of glucose in our body. Organ-wise, the major organ that consumes lots of glucose is brain, but the one really clears the glucose from our body is muscle. And muscle cannot take that glucose on its own, it needs insulin. Without insulin, muscle is helpless, cannot take that glucose in. So that is the major problem. If muscle cannot take the glucose in, then the glucose level goes up in the body, and we call it diabetes. Sugar level is up. Now, we are always continuously thinking, how can we make muscle to take more glucose in? That is the different strategy of like a pharmacologic drug development. How can we do that? Now, glucose, if they are not absorbed properly by the muscle, the excess glucose is going to make lots of damages, but they're very silent. They don't show up immediately. So suppose if I have like a glucose level high, I probably will be feeling like a little thirsty, sometimes little confused. I mean, you might think like, oh, it's a natural phenomenon. Okay, this guy drinks more, or he's like, sometimes he's confused, something like that. And that is the danger. So we overlook it. Now, if my glucose level is up, what it does, very important. Number one, microvascular complication. It damages our vessel, blood vessel. And those damages can cause retinopathy. They can make us blind. They can make us, kidney might fail. And diabetic neuropathy, that is like a severe pain into the peripheral nerve, like a hand and leg. And that pain can be so much like a uncontrolled pain. I mean, if you know anybody who is suffering from like a neuropathy, you know like what a pain is. But that thing happens late. So do we want to go there? No, we don't want to. So it is extremely important that before we get rich, that become blind, kidney damage, and like a severe pain in the peripheral nervous system, we want to stop it. Secondly, the major cause of like a heart attack, that is formation of plaque. We call it atherosclerotic plaque. Not many people know actually, if I have diabetes, I have like a 4 times more chance of developing atherosclerotic plaque in my body or stroke. Why? Because the atherosclerotic plaque, like the blockage of like a artery of our heart or getting stroke in the brain, that there is we call bad cholesterol or LDL. LDL level, when they are high in our body, they causes that plaque formation. Now, the danger one of this LDL is like the smaller, if they're smaller in size, they are even more dangerous. What makes them smaller? Diabetes. So it is a silent killer, and it is spreading like a plague, and lot of people, we are not realizing that we are in imminent danger, and we need to take care of this problem. So there are many other, I don't want to go but I just want to point out with this one, another thing is food ulcers. I mean, food ulcers, and people, once they get infection, that infection doesn't go away. Food ulcer, many people, actually, I know one of the director of NIH, he had to amputate his leg because of a food ulceration. It is so dangerous. So we have to be, there is no other option. We cannot laugh, we cannot look other way. We have to know about this disease, and we have to help our ourselves, our friends, our relatives, and make them aware of this disease. And that's all I'm doing, and she is doing today, going to talk about that, how dangerous this thing is. There are 3 major types of diabetes. One is the type 1 diabetes, which is our body cannot make any insulin. So body cannot make any insulin. Why? Because the cells that produce insulin, they are dead. So what is the treatment? Very simple. I don't have insulin, I have to have insulin, period. No other question. Problem is like a type 2. Type 2 is like insulin is somehow not working. I might have insulin. It may be various reasons. So we need to know what different reason that cause type 2 insulin. One of the major reason is obesity. When during obesity, there are various things happens in our body, including one, the fat cell, they also can bind to insulin. So now if I have an extra 2 pounds of fat, now whatever insulin I have in my body, now I have to share with that fat. So, so that is not a bad problem. I mean, you just lose weight and it will be controlled. Why am I telling that thing? Because now there is a cutting edge drug that in the market that can do it for you, just like this. So we'll talk about that. So weight is one of the major problem, and we have a solution now. We can lose weight, and we can do that. Third type, I'm not going to talk about. During pregnancy, people get it. It happens, and it goes away. But so my major uh, thing is like a major challenge actually, type 2. Why? Type 1, these people have no other option. They have to take insulin. And they will tell you, because they are going to develop like all the nausea, vomiting, and all these things. They will go to the doctor. They have to take insulin. Problem is these people. Many of us, we are pre-diabetic. We are ready. We are knocking the door of diabetes, and we don't know. We just don't know. That is the problem. So, warning signs. I mean, who can tell, like just by looking at this thing, that I have diabetes, right? Hunger, thirst, frequent urination. A lot of times we do that. Hello, I drank too much water. That's why like I'm urinating. So it is so easy to, then blurred vision, tiredness. That is actually, and also slow healing wounds, numbness in the hands, and also confusion. I'm going to tell you like what insulin does to our body. You'll realize like what a danger thing like we are actually tolerating day by day. Who is at risk? Number one, the major reason for type 2 diabetes is genetics. We inherit. Why? Because insulin, the way insulin signals, it uses like a special molecule to signal that, okay, I am here, to let muscle know, hey, I'm here, I'm here. So those enzymes called phosphatases, we don't have to know this thing, but this group of phosphatases more and more and more are getting, and we are acquiring that mutation. If I get like one of the mutation from my father, I'm going to develop, because my insulin, whatever I'm secreting, it's not going to work properly. So it's not that like, oh, I mean, it's a myth. People think like, oh, you develop diabetes because like you ate so much. And no, majority of the time actually will be inheriting the problem. That is the problem. There is no escape. So, so like I mean, so age, another one, 40 to 45, people should be very cautious and must start checking for whether they are pre-diabetes or not. Why? Many people, for like as we grow older, we get bald, we get those kind of things. Our beta cells start dying many times. Again, why it is important? Now, a drug actually that promotes beta cell health. So I have option. So I need to know that. Then high blood pressure or LDL, they are also in danger zone. Why? Because if they have diabetes, they are going to have more atherosclerotic plaque, more stroke or heart attack. 4 times more likely they are going to develop that thing. So they need to know. So if you are interested, you can take a picture of this one that going to take you to American Diabetic Association, and you can find out and distribute that. People, they can find out like what risk factor they have. Just to, I mean, for fun, like, okay, fine, how much do I have? I mean, a lot of people may think like they are not, but if they might find that, yes, actually they do have. So this is for just like once you're done, just let me know. I'm going to go to the next slide. Anybody need more time? Okay, great, thank you. Prevention is possible. Eating healthy. We are not telling not to eat. Don't do that. Diabetic people, what is the major problem? Type 2 diabetic people, their muscle is hungry because glucose is not entering in their muscle. They are already lethargic. They're already tired and it's a common mistake. Don't eat. Hurry, they are tired people. Try to find out something. But you can tell, eat healthy. Eat like a whole grains, fruit, veggies. Why? Why? Because all these whole food, grains, fruits, and veggies, they have fiber. And fiber is a big blessing in our food. Why? Because when we have fiber in our food, that slows down carbohydrate absorption. That slows down. That eliminates also cholesterol from the food. So fiber is a big blessing. Make sure to have more fiber in our diet. Sugary drinks. There are 3 types of carbohydrates.
Oh, you fucking son of a bitch.
I didn't do it. Okay. I didn't do it. So there are 3 carbohydrates that we consume. Glucose. A lot of people think like glucose is bad. No, without glucose, we are dead. Without glucose, if I don't eat glucose, I'll be dead because my red blood cell, only food for red blood cell is glucose. And it is so important that our body actually produce extra glucose. So glucose, nothing wrong. Another thing we eat is called fructose. Do I need fructose? No. Without fructose, we'd be fine. Why do we eat fructose? Because fructose is the sweetest one. We have a sweet teeth. That's why we eat like a sugary drink and all these things. Avoid it. We don't need fructose. Go for like something else. Glucose is fine. Eat fruits, that's fine, no problem. Exercise for 30 minutes a day. How do you, not running, we are not talking about like oh my God, like a 1 hour, like a really huge, like a weight and everything, no. Just brisk walking for 20 minutes at least and you are set. Brisk walking, what it does, it activates like one kinase in our body. I don't want to go to detail, but that is going to promote more absorption of sugar by muscle. So walking, brisk walking, little fast walking, every day 20 minutes. It's not too much to ask. And sleep well. Stress actually, during stress, like we secrete hormones called cortisol and epinephrine. They block insulin activity. Stress can cause or elevate our diabetes. For a long time, somebody is stressed, high likely they are going to develop diabetes because their insulin function is already compromised. So you have to understand that thing. Sometimes you might say what can I do? I'm stressed. But we can try to do, this is the basic thing. It will be my suggestion to do, not to tell not to eat, not to say anything. 20 minutes exercise, grain, fruits, veggies, and forget about stress. Try to avoid stress. That is a big start, big start. Smart eating tips will be half plate veggies, smaller plate, avoid sugary drinks, read food labels carefully, what is in there. Now, some values that people should know. I'm going to tell only 2 values. Nothing, that's all you need to memorize. That our fasting, if we don't eat for 8 to 12 hours, our sugar level should be 100 milligram, 60 to 100. And that is very healthy. It's called fasting sugar. And secondly, our hemoglobin A1C hemoglobin A1C should be 5.7 to 6.4. The moment you cross 6.4, you're diabetes. You will be diabetic. So people need to maintain 5.7 to, need to maintain 5.7 or less. That is the goal. And if you are in this range, you better be careful because you're knocking the door. You don't want to get in there. I mean, what is going to happen? I mean, are you going to feel super sick if you're pre-diabetic? Nothing. You won't feel nothing. You're fine. But you are just like going to knock the danger zone. You're not feeling anything. You're absolutely normal. That is the danger. Now, treatment, if I am diabetic, because sometimes it is, as I told you, it is hereditary. I might still get I tried everything, but still I might develop diabetes. Then I need treatment. I cannot avoid it. Why I have to take treatment? I mean, a lot of people, they try their best. They go for an alternative medicine, doesn't work. Sorry to say that. I mean, it is not going to work. So if you need a treatment, go for a treatment. Don't be shy, because if you are neglecting this disease, you are eventually going to get a much more danger in your life. So it will prevent heart, kidney, nerve, and eye damage if you treat. Your energy level is going to go up. If I don't treat diabetes, I'll be very, very lethargic because your muscle is not getting the glucose. It makes people lethargic. And you are going to, if you do treatment, you are going to reduce your chance of heart attack and stroke. So you need treatment. So tell people treatment. Don't neglect. There is no, people try their best to do every alternative things, doesn't work. If you need a treatment, you need a treatment. So we have the first option, if anybody is pre-diabetic or diabetic, lifestyle change. First, we have to. What is the lifestyle change? More healthy food, whole grain, vegetable, fruit, no sugary drink, and walk 20 minutes fast every day. Minimum, it's not big. That is the start. Secondly, we have oral medications. These are all top 20, top 200 drugs in the USA. So usually we start with a metformin, then we take SGLT2 inhibitor, DPP4, insulin. I'm going to give you 4 different drug strategy, and you should be aware of this availability of these drugs and see which one might fit with your lifestyle. The top 200 anti-diabetic drugs are in number 2 in top 200 selling drugs is metformin. Number 19 is semaglutide. I'll talk about it. 30 is insulin itself. 34 is a Jardiance or empagliflozin. It's an SGLT2 inhibitor. So these are basically 1, 2, 3, 4 is your best option for treatment. In number 42, you are seeing this one. You see the cost is very cheap, but it is deadly. If you know anybody is taking that thing, let them stop. Because now I'm telling you, because the study shows that 5 to 6 years of using this drug, glipizide, that might actually kill your normal beta cell. So only because some people will take it, it works great. and also cheap. So somebody will tell them, don't do it. Just don't do it. And you are not that poor. You are in USA, you are not that poor that like you have to go for this one. All right, so this is there are many other drugs, but you are actually going to learn 4 major way we can control, and there are a lot of good news I'm going to show you. Metformin will be your first choice. If I get the diabetes detected, the first thing you are going to try is metformin. Why? Why? Metformin is, number one, very cheap. It is almost no side effect, almost nothing. I don't know anybody having, unless like somebody overdosed. Drugs, the important thing is, remember about the drugs are like a relationship. It always comes with the baggage. That is adverse reaction. There is no drug without any problem. And second thing, that drugs are, if you miss a dose of a drug, that is okay. Overdosing, that is going to kill people. That is the major problem. So if somebody say like, I forgot, well, it's okay, don't worry. If you can remember like you took the drug or not, just fine, take it tomorrow. That is a very important thing. Now, metformin is like the uniqueness of this drug is like, you have to look at this value. That like a maximum dose of metformin can lower your hemoglobin A1C by 1.5%. So if I have like a very high diabetes, like my A1C is like a 10 or more than 9, this drug is not going to work very well for me. It can be additive at that time. But if anybody have like around like a 7 to 7.5, that is the safest drug because it is anti-inflammatory. It is even anti-cancer. And it also increases the glucose absorption by muscle. So the lethargy people feel during diabetes, that will also get removed. So anybody diagnosed with the diabetes, but just at the beginning, start with this drug, number 1 choice. Well, next choice, maybe if somebody is like A1C is too high, it will be insulin. Insulin is one of the major problem with insulin is it is injectable. People are still like scared of like injection. But nowadays, the needles are like almost you won't feel anything. It is so much improved. So it is no more like a needle phobia. It is not any more excuse. And another thing, like look at the power. It has a robust power. It can lower A1C up to 4%. So that is like not a single other drug has like that much power. But insulin also have 2 major problems. 2 major problems. One more thing before going to the problem. Now, insulin is going to be definitely for those people, if I have a type 2 diabetes and if my body is not producing enough insulin, then insulin have to be your major choice. Because I have less insulin, I'm taking insulin. But insulin also is important because if I have less insulin in my body, I'll be very confused. One of the treatment of dementia is insulin. Because insulin improves our memory and a lot of things. So anybody, you should ask the doctor, can you check like how much insulin my body is producing? If it is low, I'd rather take insulin because that is a better option for me. Not many healthcare provider might think that way. That's what I'm telling. The disadvantage is weight gain. Insulin comes with weight gain. That is the major, weight reduction, that is the challenge of diabetes, but the insulin will be coming with weight gain. So they have to have a really strict lifestyle change. So that is the challenge. And the second one is hypoglycemia. Many people actually died with insulin, and insulin is a unique way to kill people. Many caretakers of rich people, they killed that their person who was they taking care by overdosing insulin. Because insulin is not going to, because whatever glucose I have, if I'm fed or not fed, doesn't matter. It is going to take all the glucose into the muscle. So your brain, it will be foggy if you're driving, if you're like a sleeping, I mean, people will die. So insulin, but good news is like this one, this is called Glargine. This is a long-acting insulin. The chance of having hypoglycemia with Glargine is much less. So we improved a lot. So even like an insulin, but still it is going to make us fat. That is the only problem with insulin. Now the question is, why is that? That is important question. How can we avoid that? Oh my God, can you tell me something like that won't make me fat, but like all the other things will do? Yes, we have miracle drug. What is, there is a good news is like there is a once a week insulin will be available. It is available in Europe, but not yet in USA. So that will be, I think, will be kind of game changer for a lot of people. But it is not here yet. Now, this is another kind of drug you should know. It's called SGLT2 inhibitor. What it does? What we actually don't, we give like our glucose so much importance, we don't want to lose them. I mean, during the production of urine, whatever glucose comes out in the urine from our body, we again reabsorb the glucose. It is so important for our body. Now, this reabsorption, if we can block the reabsorption, then we can lose quite a bit extra glucose. And this drug will do that thing. It's named, there are 3 gliflozins in the market. And I just gave like a empagliflozin because it is so important because it protects our kidney. And secondly, it protects from cardiovascular event. So if you know a patient also have cardiovascular issue, this is your drug of choice. That's why like I just showed you, it is, and this is also top 200, within top 200 because it is really beneficial actually. And it is by clinical study that shows. But again, there is no problem except like people get UTI, urinary infection, because they lose like so much glucose in their urine. So you have to tell like you gotta be very clean. That is the only problem so far we have. I think that is doable. That's not a big thing. Little higher side cost-wise, like a 400 to 600. Hopefully it will come down pretty soon. But it's a great drug. Like if anybody have cardiac issue, they should have this one. It's a great drug. Then let me talk about like a GLP-1, GIP that completely changed the whole game in the diabetic world. It's over. It's like a big, huge thing. So I told you that like when we eat carbohydrate, then like our intestine actually secretes 2 hormones. One is GLP-1, another one is GIP. And that hormone eventually goes to the, secretes into the blood that travels all the way to the pancreas. And then like a pancreatic beta cell, they have the GLP-1 and GIP receptor. They will bind over there and they are going to promote secretion of insulin and the buzzword also amylin. They secrete two. That amylin is the magic. That's the magic bullet. What amylin does? When we normally eat carbohydrate, you just had like this sandwich, our body secreted insulin, and along with insulin, we also secreted amylin. That actually is a balance of insulin function that keep us less hungry, satisfied, and this amylin is like a make people absolutely, cool feeling that even like a little bit after eating little bit carbohydrate, they feel complete. Oh, I'm satisfied. I'm not hungry anymore. This is the key. Now, GLP-1, GIP, that promotes secretion of both insulin and amylin. And they promote like so much amylin that actually anybody take this type of drug, semaglutide, like a GLP-1 analog, semaglutide, it is again top 200, they lose weight significantly. If you see a person like maybe like 3-4 months later and look like lost like quite a bit weight, don't embarrass him or her by asking, just because it's taking this one. Don't even ask. Don't bother to ask. It's doing this one for 100%. It's called Ozempic. All right. And that is a great news. And if you look at that, it can do like up to almost like a 2% A1C reduction. That's pretty powerful. So you're doing two things. You're reducing A1C. And what was the problem of diabetes? Overweight, obesity. You're losing the weight. And that is taking over all over the world like a crazy. I mean, if you bought like some of the stocks before, I think like you are rich now. Those things like a big, but they are like they are costly, but insurance is covering. Insurance is covering. It's not that bad. Now, this is over. This is the final thing right now in the market. This is, what can I say? This is actually, this drug, they mimics both GLP-1 and GIP. The first one was only GLP-1. This one is like a dual. And this is pretty new. I mean, and look at like a lowering capacity, A1C, 2.3, almost close to insulin. People are losing weight like crazy. And they are not hungry at all with this drug. Its name is Mounjaro and tirzepatide. Mounjaro, that's the new drug. Eli Lilly stock went from 200 to right now 900 because of this drug. And people didn't start yet even. All over the world, like they're waiting for this drug, everybody. It is initially like but it's so far like what I read, all the trials and everything is pretty safe. This is the most powerful, almost like and this is injectable, but again, like the nowadays, like injection, people don't feel anything. And it is once a week formulation. It's nothing. This is actually, we are standing right now. So, yes, diabetes is a bad news, but at the same time, we have some good news too. And I just introduced you like with the major 4 categories of the drug, and think about like who is having what problem. If somebody just at the beginning, but these drugs are selling all over the world mainly because people are trying to lose weight though. But it is a fantastic drug for diabetes. So let's see what else. So modern advances, we have smart glucose monitors, insulin pumps. Because checking the blood is like a lot of times an issue, but Now we can have like a monitor put in our hand once, and then you can monitor like for quite a bit time without just take your phone over there and you can get a count. We are not yet, but like we are going to have a watch even eventually. That watch is like is going to tell what is the glucose level. I mean, I'm telling you, it is just matter of like a few, maybe 1 year or so. We're going to have that one pretty soon. And then we also have like a lot of AI-based apps that is going to help you to tell you like a diet and everything. Yeah. So you are telling like whether GLP-1 like prevents the appetite or not? Yes, that's what exactly I said. People are not hungry anymore once they take them. So that is the problem. So you are asking like if people don't eat, like when I have GLP-1 drug that promotes insulin secretion. What insulin does, that let glucose enter the muscle. If I have diabetes and if I don't eat anything, my muscle is going to be super hungry. Your glucose is not going to enter muscle without insulin, period. You cannot pump it in your muscle. That is the biggest mistake. Thanks for asking the question. That is the biggest mistake. Like we tell diabetic people, don't eat. Man, they are suffering from that. Their muscle is like I mean, you just tell, no, don't eat. Is that a treatment? No, that's not a treatment. Treatment is this. Treatment is GLP-1 drug. That is treatment. Not by eating. I mean, nobody can adhere to that lifestyle forever. Nobody. It promotes secreting insulin. So diabetes is the problem of insulin. It is promoting insulin secretion. That is the treatment. Why do I have diabetes to begin with? Because my insulin is not working. The major treatment is two. It's promoting insulin secretion. It's blocking like a hunger. So that's the, I mean, amazing solution. Win-win situation. Exactly. Exactly. That's a win-win situation. So thanks for the question. Focus on what you can do, stay positive, celebrate progress, not perfection. Diabetic people don't say like that you have got to be perfect. Rather like one step at a time and encourage them like you do a great job. So myth versus facts, only overweight people gets diabetes? No, anyone can. Eating sugar causes diabetes? Fact, it is about overall lifestyle. Medicine let me eat anything, it works with healthy choices. And problem is, as I told you, the silent nature of the diabetes. 1 in 4 adults with diabetes don't know it. Don't know it. I mean, we did like a camp in a park. People are like waiting, like, okay, can I measure your glucose? I didn't do it, like our students were doing that. We measure the glucose. No, I'm fine. I'm healthy. Then measure the glucose. It's like 350. They don't know even. Well, I'm fine. And that is the problem. Yeah, it's not a. Early diabetes may have no symptom. Damage to eyes, kidneys, and nerves may already have begun by the time it got recognized like that they have diabetes. Simple blood test, detect it early. Don't wait for symptoms. Get screened, move daily, eat balanced meal, stay connected with your doctor, never give up. And I'm going to play you a short video which I created by AI. What's that? So, okay, not show the video?
She has the dog and we have.
Oh, okay, that's fine.
We're going to show the video at the end.
No, that's fine. No, no, I mean, video is not important.
Use the clicker. Use the video. Got it. Nice. Thank you. Nice. Good evening. My name is Stephanie Gerken. I am from Michael's Angel Paws, the founder, and today I have the privilege of presenting here with Roseman University in their neighborhood series. So it's an honor to be here. Thank you, Vanessa, for setting this up. I'm going to not butcher your last name and call you Dr. C just because I can't do that. Like, I'm just going to leave it there, but thank you. Thank you for a very informative information on diabetes. I mean, I know it's affected my family a lot, so it's nice to hear some of that information too as well. But today we're all about the nose. We are more about on the side of helping with manage your diabetes, whether you're type 1 or type 2 with the use of a diabetic alert dog. So tonight we're going to go over what is a service dog, what is a diabetic alert dog, the nose knows, the science of a dog nose, and a very general appeal. I am not a veterinarian and I'm not a doctor. I will state that right there. Just a dog trainer that enjoys working with dogs. How to get a diabetic alert dog, and then we'll have a nice Q&A session with Jade and Simba. Simba, for all you guys know, is a 4-legged golden retriever that is currently doing his job well and sleeping under the desk. So yay for that training. Thanks for making me look good today, kid. And of course, we'll do questions, so yes. So what is a service dog? Service dogs are defined as a dog and or, believe it or not, a miniature horse. That is specifically trained to perform a task for an individual, whether it's visible or invisible. Most of us that have diabetes, it's an invisible disease. You wouldn't know looking at me, or I don't have diabetes, but you would know looking at an individual if they have diabetes unless you know what to look for. The role of the dog that we do in our service dogs is to train a task that they give that person that they are unable to do. A guide dog, the guide that they help visually impaired individuals. We do mobility training too as well. So that would be person who may not be able to pick up things, may need help with balance, opening doors, living the life that they want to on that. With that, they are granted public access. There are a few exceptions. Surgical suites, and you do not need your dog in labor and delivery. There are some things dogs just don't need to see. That would be one of them. Usually a service dog is identified by wearing a vest. There is no color coordination as to what the vest has to be color. It can be pink, blue, purple, tie-dye, I don't care. Whatever you like, whatever fits your personality. But it is not a requirement by law to wear a vest. Most of us choose to wear a vest. It's just easy when you go in and out of places not to be questioned every 20 feet if you're trying to buy a gallon of milk at local Walmart. Training can take up to 2 years when you do begin to have a service dog, whether you do it by yourself or given to an vet. And fun fact is, yes, service dogs get to be dogs when they are not working. They enjoy it. So what is a diabetic alert dog? Diabetic alert dog is defined as one that is protecting to detect changes in individuals' sugar levels through their nose. What they enroll the dog to do is to alert that person or another individual of the change in sugar levels. This is very important for type 1 diabetics. When they're sleeping, most parents decide to get a dog for their child so they can alert the parent while sleeping so the parent can at least get some sleep, because that helps minimize your whole offer a type 2 diabetes, more sleep. Same with individual, they are granted public access. They'll usually be identified by a vest. Training can take up 2 years, they get to be fun. So it's just that, it's just the difference of that. So when you look at the overall service dogs, there's what's called the assistance dogs and then guide dogs. They're kind of their own separate entities. that just like shot up. That was weird. And then it's broken down. Your subsistence dogs will be broken down into your mobility and what we refer to as your medical alert dogs. But it's just an open thing that that dog is alerting to your medical condition. We're not lying about it, and they don't need to know what you have. It's not their business today. So the nose knows. I have to read my notes on this one because I did not memorize it all yet. So the dog knows. Whoops, don't do that. So the dog's nose is much like our eyes. As humans, we see our world through our eyes. The dog sees their world through their nose. They're able to walk into a room and they can smell anything. When my dog likes to stop and sniff at his poles when we're out on his daily walk, he likes to stop and get his TikTok messages, his Instagram updates, and his Facebook messages all right there. He can tell where all the girls have been and if they're ready, if you know what I mean. This is Vegas, right? We've been here before. So what's really cool about why the dog's nose works, their noses are wet for a reason. The wetness of a dog's nose allows them to capture that smell. And believe it or not, the nose serves two functions, breathing and smelling. So it's pretty cool with that. It also serves that little indentation that the dogs have, that little guy has it right there in the little yellow there. That actually has the most surface area for smells for a dog. So it's got all that stuff there that helps them too as well. And actually the dog's muzzle, as cute as it is actually designed to help one of their biggest olfactory positions, and that's what their brain is designed to do. I love facts. I have useless facts in my brain, and this is one of my favorite ones. But dogs have over 300 million olfactory receptors compared to us humans that only have 6 million. Don't ask me to do the math on that. I am a dog trainer. And the majority of a dog's brain is dedicated to their smell. So imagine a beagle. That's why beagles exist, because they love the smell. And they have some pretty cool stuff. They have, most of it's designed for their olfactory urge, and they have special things in there that help them identify scents. And what's really cool about that is they can identify individual scents and actually put that in their memory to help with scent mapping. So like if you haven't seen a dog or a friend in a while, that dog will remember you because you have a distinct smell, and they can remember that chemical changes. There's also a couple cool things there. They have special 3 adaptations. They have the Jacobson's organ, not what else that other is. And that's kind of like where sharks are able to detect that small changes with the blood and the stuff in the waters. That's where dogs are able to detect the pheromones and the chemicals in our changes. And that allows them to detect the changes in your glucose levels. And that's where the diabetes comes in that. Then they have cool cilia. I hope I pronounced that right. Oh, yes. It's been a long time since I've been to college. And those help detect foreign object in there, keep that nasal cavity clean. And then we have the turbinates, and they can control how they're increased for greater smell too as well. If you have questions about body parts and anatomy, there's that. So the way this looks is we'll just take a brief look at kind of this is a very brief anatomy of a dog. So you have in there, they'll come in, they'll take a breath. You have all the regions there. You have their brain, their olfactory bulb, the Jacobson organ, and their olfactory region. And then how they sniff that, we'll go into more detail here. So what happens, I don't need these things anymore, what happens is they'll go in, they'll take a breath, they'll be out there. I know we'll bring up Jade and Simba in a minute and go through that. What they'll do is they'll go and take if they're smelling a rose, they'll go and take a sniff with that, and it'll be distracted into 2 parts. One will go to their lungs for breathing, and then 2, it will go for smelling. And of that, they'll go to their odor detection, where they'll be then given to their olfactory organs where they'll do that. Then they'll go to the olfactory bulb, which is then connected to the olfactory nerve, which helps then go to the brain and stuff. That allows them to do the scent memory and the interpretation and to keep that there. And also you have the Jacobson organ there too. If I could pronounce it, be fantastic today. So what we do is when we bring in a dog and we do the training of a diabetic alert dog, we use a lot of different stuff. Some of our things include some everyday fun stuff. Can they see this on the video? I don't really know. Oh, they can. Okay. So when we're doing training, we use lots of treats. Dogs are all trained. They have lots of treats. And then we use these things. When you go to the dentist and get those nasty, fun x-rays, this is what we use to get the scent samples, and our clients love them when we ask them to get this because they don't taste good, do they? They're gross, aren't they? Yeah, she looks at me like I'm crazy. Yes. What we do with this is we ask them to get several different ranges. 1, their normal ranges that we need. 2, we ask them to get their high levels, depending if we're training for type 1 or type 2. And then we ask them to get their lower levels. We actually work with their doctors to make sure we're keeping them in their range. We want to make sure that they're here Usually we do anything below 80, we want that dog alerting to before it suddenly drops and then we're having to seek medical intervention. So what we do in the beginning is we actually teach them a fun thing called nose work. And here we have treats in here. And this teaches them how to do it. This is your run-of-the-mill seasoning thing, hold your seasons when you cook. I don't cook, my husband does, it's his job. So then we teach the dog actually what we're looking for is when we start their training is we're going to teach them that level we want. We have it going with our game plan. What we're looking for them to do is they're going to go and sniff this and we're looking for their nostrils to flare. They actually have control of that and they'll get this big woof of it. And as soon as they smell that, we're actually going to treat them and tell them good. And that allows us to communicate to them that they've actually done what we're looking for. And then we'll continue with that. Once they understand the game, because a lot of times they aren't taught how to use their nose. So now we're utilizing that nose for a specific thing. Same thing reason if you're working with the bomb detection dogs, any of the drug sniffing dogs, it's the same thing, just a different scent. It's easier for me to get saliva samples than all the other fun stuff out there. So once they're there, then we'll actually swap that out and we'll actually use actual cell samples. This is what we ask our clients to do it for. Jade was actually very nice and gave you some really nice samples. Thank you, I appreciate that. And then we actually will teach them this actual particular alert. And we don't ever put a word cue with this when we're training them because we need to have the dog do the alert on their own and not just wait for the tin to be the cue. We need them to use that nose to alert you because at the end of the day, they've got to be able to do this in all areas. So once we've taught them how to use their nose, at the other time, we're also teaching them an alert of when they smell those smells, either highs or lows, they need to indicate to that individual what they're doing. We typically teach just a paw on you because it's much easier for a dog to paw you than to teach a bark. And a lot of times if a dog barks in the middle of a thing, people are like, oh, it's not a trained service dog. It is. And once you maybe start a barking behavior with the dog, it can be hard to change. So we usually teach that and the dog is taught to hit and to keep hitting until that person acknowledges that they've done it and they've taken care of those sugar levels too as well. We've also taught some of our dogs. This is one very old test kit that we have. We also teach the dogs sort of like a mobility dog, but we'll teach them how to go get some of these packs and also a go bag. So for those that are type 1, we teach them how to put their sugars in there, their orange juice, glucose tablets, anything they need in an emergency. And we create a very special word with that. We've had one, I know your dog's name is Stitch. Simba, sorry, I'm losing my marble state, time to go. We can teach a word that they know what that is. So like Simba, I would say, where's Nala? And he would go and get Nala. Nala being your go bag with all your stuff, because Nala is not a word that we're going to use in our everyday language. You don't have to use that, I'm just messing with you. Yeah. We had another team that was named Stitch, and her word was Lilo. So it's yeah. So we just use those words so they go get that, and they can bring that to the individual to help get them back to normal and stuff like that and be with them the whole time. Nice. You ready, Ms. Jade? And Ms. Simba, Mr. Simba? You ready? Okay, you got this, girlfriend. Come on up. Yeah. Bring Sims for me. We're going to give Jade and Simba a nice round of applause for joining us today. Oh, Simba's sleeping on the job right now. Jade is recently diagnosed with diabetes, right? You're doing good. So Jade was recently diagnosed with diabetes, right? Yep.
Yeah.
She is an amazing 10-year-old, right? Are we 10 already?
Yeah.
Man, I'm getting old. And she has had the joy and privilege, and we've had the joy and privilege of getting to know you, your mom, and Simba. And she has taken the training of her own diabetic alert dog under her hand with the guidance of her mom, who's there every step of the way. And Simba has helped you the whole time, right?
Yeah.
Yes. And you love Disneyland?
Yes.
And Stitch?
Yeah.
Yes. And so Simba has been here. Tell me how Simba has helped you. Or tell them. You can tell me. Here, have a conversation with me. We'll just ignore them for a while. How's that? How's he help you?
like in the night when my sugar like drops really low, he'll like start going crazy and then like start like sometimes tapping me.
Good.
And then like he'll just keep licking me until he like gets that I already ate something.
Good, that's nice. So Simba is 10 months old, believe it or not. He started the program when he was this big. Now he's this big. And we have been able to see Jade's confidence grow by having a service dog by her side. And then he's also saved your life a couple times, hasn't he?
Yeah.
Only 10 months of age. And now he's graduated. What module did we just graduate? 3. Glad somebody knows around here. So now we're moving into modules 4 and 5. We have a service dog program broken down into 5 modules. Now we are going to begin the task training and actually adding the alert. He already alerts with his own special ways that he's learned, which is great, which is looking. Now we're going to alert with the paw and stuff like that. And what else are we going to learn? Do you know? Did Abby not tell you yet? No, that's okay. Oh, teacher to get your bag. You want to try on that, see if he'll do it today for us? We'll try today. Do some little training? Okay, cool. Don't tell Fabi we did some training today, okay? All right, so we've got our tin full of treats. So what we're going to do is we're going to look. Here's our tin. They'll smell. Oh, they're gross, aren't they? I'm going to go ahead and put my hand here. We're going to sniff. We're going to see if we can get his nostril flare. Why don't you go in, handsome pants? Good. And we're just going to treat right there and let him know that's what we're looking for. And do it one more time, handsome pants? Do you want me to do it? You want to do it? You ready? Okay. Good. That boy. Do one more time. Okay, should we move over here? Okay, let's go this way. I was like having a demo dog. Ready? Good. I think he's got the understanding. Got it? So this is be a phase that we go through in training. Now we're going to introduce your sugar levels. Which was this one at? 400?
That was 220.
220. Okay, ready? So what are we going to look for? His nostrils to flare. Okay. Good boy. And he licked it, which is actually one of his cues he's already been doing to alert mom and dad. Nice. Let me go back over this way. Okay, this way. He likes this. Good. Ready to do it again?
Yeah.
Good boy. He's so smart. Do it again? Okay. Good boy. Nice. Oh, you want to do the gross part now? I didn't tell you about this because you would have said no. So as they get to understand it, we're actually going to have you take the swab. You get to touch this. I like you, but I don't like your saliva that much. You're going to take this. Do we hold this? Am I going to do anything? Are you ready? Okay, take that piece. Yeah, he's already alerting. There you go. That's a good thing. Okay. Yep, just you can do it. He's already doing it, which is great. Just pick one. I don't know which one. You touch it and put it on the back of your palm. You already take the dog. Yep. Yep. Rub it on the hand. Good. And then just put your hand by your side. Oh, you want this back. Oh, you're so picky. All right, you ready? Okay, we're going to walk him by. See how you got it? We missed it. I don't have nothing. Good. So put your hand right here in front of him. Is that the one you licked? Nice. Tell him good. There you go. Good. Do it again. Good.
Good boy.
Nice. Do it one more time. What are you going to tell him?
Good boy.
That's it. Better be after. You better know good after this many years. This is 30 weeks of training. Nice. Good. Cool. Thanks for helping today. Can we ask you questions later if need to?
Yeah.
Okay, cool. You can go sit down next to mom. Cool. So now we've seen how effective a diabetic alert dog can be. Now the question is a diabetic alert dog a dog for you? So there's a couple things you want to look at. There's always pros and cons to bringing in a service dog into your family, whether it's a diabetic alert dog or we're training it for something else. It can help with early detections, does give increased independence and safety, companionship, education, and 24/7 monitoring. The cons of it, it is a high cost. Service dogs are not cheap. I wish I could tell you insurance cover them. They don't. There is a huge time commitment. Our trainers, we work with them for about 56 weeks. It's about a 52-week to 56 weeks that we work with them on a weekly basis for about an hour. That doesn't involve the amount of training they put in outside of us. We always offer support to our teams, emails, text, and messages at all times. It does not replace medical equipment. So still use your medical equipment. This is just one more tool we are putting in your toolbox to maintain and manage your diabetes. You will get public access scrutiny. People will look at Jade or look at one of us and think there's nothing wrong with us, and why do you have a service dog? There are daily responsibilities with having a service dog: feed, watering, bathing, grooming, all that fun stuff. And then maintaining training at all times. So even though they graduate our program, they still have to do daily training of that and keep up their training. Just like us, if we don't do math on a regular basis, we lose the math skills. Same thing with the service dogs. If we don't keep up on their skills, they can lose those skills. But what's nice about that, if you go back and review how to do math, it comes back to you. And that's what it does with the dogs too as well. Oops, I skipped one. Oh, things sensitive. Nice. So options for getting a diabetic alert dog. You have a couple choices when it comes out to here. The ones that we do, there's fully trained dogs. Those are ones that come from like Canine Companions for Independence for various disabilities. And one that's well known here in Vegas is the Diabetic Alert Dogs of America. Those dogs are fully trained. What does that mean? They've been public access trained, task trained, but you may have to travel to that place. What that does is somebody has willingly volunteered and raised that dog from probably about 4 months to 18 months of age as a volunteer. They take it back to the place they got it from. Then a trainer will work with that dog for another 8 to 9 months and determine if that dog is ready to go on to the next phase of training. Unfortunately, the reason dogs are so high, the fully trained dogs, is unfortunately there is a 70% failure rate in the industry. And it's not that they're all bad dogs. It's just becoming a service dog is like sum cum laude, whatever up that I was never there. But it's a very high level that we ask them to do. Some of those places, if you will have to travel to their site, so there is expenses with that. Usually it's about a 2-week program that they have you go out. They've got a variety of dogs that are ready to be matched, and you'll get to work with those dogs, and then they'll do a matching process, and then you'll do another week of training at that site, learning how to use that dog, be aware of it in public, and all of that. With that is, it does come with about a 2 to 5 year wait list. And that's from the time you apply for it, go through their vetting process, and get matched with the dog. With that, there is limited customization because they're doing the normal. There's just these that they have to go through. And that dog, much like one that they've done with Simba, takes thousands of hours of training. And it will be when you bring the dog home, there will be a period of adjustment. That dog will need to get used to that family. You'll need to build a bond with that dog. And there could be some oops and stuff, but you will have that full support of that. Then we have what we do is we are ones here in Vegas based that we do what's called an owner trained. This is a proud program that I've been able to take part in with the trainers and all of us back at Michael's Angel Paws to bring this together, where some people can come and train their own dogs under our guidance. So we actually get to be their canine coach. And it's a fun process to work. Training does take up to about 18 months. And we have it broken down into about 5 modules. Each of those modules are 10 weeks, and they have to pass certain points to move on to the next module. This can be, there's not really a waiting period. It can be just vary as we get group classes together. It's fully customized. There's an increased bond. There's flexibility. There's a reduced overall cost. Of course, insurance does not cover service dogs at this point either. There is a lot of personal growth, just as you learn to navigate having a service dog and learning to navigate with a disability too as well. And we have had the privilege of seeing many teams grow outside of it and do amazing things with that. With your owner train, you do take a high risk of the dog failing. With us as an agency, we do everything within our power to make sure that doesn't happen. It does happen. Some dogs are just not meant for it, but we try and do everything that we can. And you may need to at some point reach out for professional guidance too from us, and we're always here. And then the biggest one is lots of time and lots of patience. There are times of frustration, times of crying, but we are here to support them the whole time. And then that's it. I know it's pretty simple. Questions?
Yeah, questions.
Please for the mic. My louse is void, but they still put me on a mic.
So the limited customization, I'm guessing that each individual person's scent of the rising or lowering levels is different, right?
It's not. So it's the same chemical, so they can use multiple ones when doing that.
Okay.
But when it comes to customization, that's more of like, sometimes with the I'm going to pick on the Diabetic Alert Dogs of America because I know they're not here, but they are due out here, is they'll just do that scent for that particular one because it's a drop that most of them are looking for.
Okay.
But the customization comes from like teaching the dog how to go get a go bag for that one. So we can add a little bit more customization. Our teams will always leave the program with an understanding of blocks and covers. We do that for safety, as well as our veterans with PTSD, because what it is, if the dog's coming towards you, they'll do a block so nobody can come in. And then the other one we'll do as a cover. So you're facing 6 o'clock, or you're facing 12 o'clock, and they're facing 6 o'clock. So nobody can come up and touch that person, and then you turn around and slug them. And then we work on bracing. They'll do an introduction to scent and retrieval. Did I miss one? Oh, and DPT, deep pressure therapy. So most of our teams will come out of that. And the deep pressure therapy is really to help them in a situation in that crisis, just reduce the anxiety going out. What was that?
In the fully trained program, you don't just.
Yes.
You can't like pick your own dog.
Yeah, so the question was, in a fully trained dog, if you're going through an organization, you can't choose who your dog is. Yes, that's also another form of customization. The dog, you get this choice of a lab or a golden lab, depending on what that agency uses. I'm a golden retriever sucker, so I love my goldens.
Here we go. Come on over.
Hold on, let me get that one. I know you raised your hand second. I love questions better than.
Thanks so much. Wonderful presentation, by the way. So just curious, with your customization, can the animals or the breed have a factor in some of the success rates, or does it like matter? You can pick anyone.
Good question. When it comes to breed, not too particular on the breed. What I'm most important is the temperament of the dog. So when they come through the program, there's an application process we have them go through. If they have a dog, then we'll bring that dog in for a temperament. And basically what we're looking for is what is the dog's reaction to different stimuli? How do they respond to a dropping of a board? How do they respond to different surfaces? I usually pop open an umbrella because most dogs have never seen an umbrella because it just doesn't rain in Vegas all that much. So it's more of like a startle response is really what we're looking for. And in that startle response, do the dogs want to run away and go pee themselves in a corner? Or are they running ferociously towards that thing wanting to attack it? We're looking for the middle road. And even if they show a little signs of like nervousness, and I don't want to say aggression, but a little bit more ferocity, if that's what I'm looking for, we can work with that. And do we fail dogs? Yes. And it sucks every time we have to do it. But we have to honor the dog. So at the end of the day, our job as the coach is to honor the dog. If the dog's not meant to do it, we're going to have that conversation. And no matter how I put it, I still cry. Because I know how much work they put into that dog, how much heart and soul has gone into that. And it's a very hard choice. But we try everything within our power to do it. Sometimes we do a career shift where the dog just ends up working at home. And that's where somebody needs that dog for a while, is they just need a home helpmate. They don't get out much. There's a lot of Monica, so they're more homebound. So that dog can help them with picking up keys, picking up mail keys, picking up the cell phones, shutting the doors, opening the fridge, things like that, or actually bracing with them and helping them get items too as well. So there's lots of different spectrums. We just don't want to say, nope, you're done. So that's where it becomes a little bit more customizable too, is we're here to support the whole process. Yeah.
Stephanie,
You had a question.
I'd like to add on to that. You
Yes.
asked about breeds. In terms of size, when you first came
Yes.
and you brought dogs, there were little dogs, medium-sized dogs, big dogs. So how important is the size to do this kind of work?
Size for diabetes is not an issue unless you have what we do dual modalities where we're actually training for more than one disability. So you can't have diabetic alert dog, have a little King Cavalier, and then need mobility assist. So the breed also depends on your needs of what we're going to do too as well. Like with Simba, I would not suggest a Doberman. Because we have the autophagy as she may return back to school. It's going to be hard to bring in a Doberman into a school and expect everyone to be like, yeah, let's expect this Doberman in class. And you're like, yeah, okay, no. And you want to also look, and we see a lot of times your more floppy ear dogs, your Goldens and your Labs, America's #1 and 2 dogs, they retain what's called neoteny, more childlike, and so they're wanting to more please their handler more than your pointy ears, Malinois, and German Shepherds that are like, oh yeah, let's go, let's get this thing on the road. And for someone with a disability, it's nice to have an easygoing dog and not one that wants to like, oh yeah, what are we gonna do today? Now that doesn't mean they don't have their stubborn moments, Simba, but they're also going through, their developmental stages too as well. I mean, a dog his age goes from 0 to 18 years in 0 to 12 months. So there's a lot that goes through it. So yeah. Yes, sir.
I know there are a lot of electronic devices you can wear to monitor your blood sugar and warn you. Do most of your clients have both the electronics and the dogs?
Yes, most of them have both, most especially for more of our type 1 diabetes, because the critical period for type 1 is at night. So it's nice to have, and Jasmine will probably back me up on this one. It's nice to have the extra set of eyes and ears per se, and smell, because sometimes that stuff can fail.
You can, I have diabetes. You can feel when low diabetes comes on. That feels obvious. It's the high diabetes that's the problem because you don't know you got it.
Yes, and that's where we teach the dogs, depending on what the doctor has for you, in that range, anything over, I don't know, I'm not a doctor. What's your high, what does the doctor not want you going over?
My levels typically, it's been a long time. I'm under control at about 110 to 115. I think I was about 200 when they diagnosed me.
Okay, so probably anything over 115, that dog's gonna be trained to alert. Yes, so yeah. Hold that theory. Come right back to you. I love the questions better than the presentation. It's just. It is.
I'm just curious, what are the limitations and risks with the patients that are relying on these diabetic alert dogs?
Same thing with all your other hardware stuff, malfunctions, missing it, sleeping, tired. As the dogs age, we worry about their age too as well. Simba's 10 months old, so when we hit 8 years, we might be thinking about a replacement dog for him. So regardless if you go like there's the risk of malfunction with that, them skipping it, things like that. That's why it's used as a dual system and not that. Was there one thing I missed? Any other risks?
No, it was just the limitations and.
Okay. Yeah, and I mean, and there are other limitations as far as like public access. That also gets kind of dicey from time to time. We've had many of our teens scrutinized and criticized and, made to feel less than that. So a lot of it comes down to, we are also there to support the humans too as well. So it's kind of like a dual thing that we do with limitations and stuff. Yeah. Yeah, so there is kind of a disconnect with like service animals in hospitals right now where the liability lies with that. Is the service dog granted access to the hospital? Yes, but it's not the hospital's responsibility or the staff to take care of the dog. So that's why when we bring these in, we ask, do you have a support system? And that's, yeah. Ambulances I've gone back and forth with because I've been in contact with AMR and community and Medic West, and they're just like, they all don't really have a solid protocol, if that makes sense. Yeah, and it's hard. I mean, I'll tell you, there's the #1 thing that we deal with as a service dog training company is the fake service dogs. And that's a really hard, you can't say yes. I mean, it could be a well-trained dog, but in the instance with the human, they also have to look at the ambulances. Is it putting the medic in danger? Is it endangering the medic's lives? There's a lot of different caveats that go with that, and it just depends on the situation. And so that's why we say have a support system that, like, if Jade, I'm not saying she has to, but if Jade ends up in the hospital, we've got dad and sister to take care of it. My mom goes to the hospital or vice versa. So there are things out there, but there are limitations. There are scrutiny that gets there all the time. And that's the biggest thing we deal with is building up the human and that personal growth department is just being able to say no and being aware of their laws too as well.
Thank you so much.
Yeah.
Question down at the bottom. Jasmine, was that you?
So I know you had asked earlier about well, I can't remember exactly what you asked, but it was about the lows and the highs. And so the thing is, for example, Simba, before she even reaches a really bad low, he catches it before the devices do. And there was a night where I think he was, because again, he's only 10 months, but he started actually alerting her when he was about 7 months. And there was a time where she dropped to a 40 and he immediately like started licking her and was jumping on the bed. So now he starts alerting her for some, like right now she went to 150 and then she started going up and he starts licking her, doing all these stuff. So sometimes the devices do malfunction and there's sometimes even 15 minutes delayed. And if it weren't for him waking her up that night, she would have been, yeah.
Feel the lump coming on before it really gets bad and you start sweating and stuff like that. Highs
Yeah.
have tremendously high levels, never know.
Yeah.
Yeah.
At nighttime, it's scary too,
Yeah,
because
at
nobody
night-
knows you've dropped below those levels, so.
Then she doesn't feel so at least with her with type 1, she doesn't feel the lows during her sleep, which is why their rates of dying in their sleep is higher than the highs. Yeah, but she does feel her lows when she's awake.
Yes.
She feels it. So I just wanted to answer that question too.
Any other questions for Dr. Chakraborty? Thank you all so much for being with us tonight. Thank you, Stephanie. Thank you, Arup.
That's our shameless plug for today. If you have questions, we're always available on email and all that other stuff I don't know anything about.
Thank you. Can we get a picture?
Yeah. They're game changers.
Yeah.
Because you don't over the center.
Then there's always hope.
Yeah, exactly. Would you guys be in a picture? Yeah, of course. Do you mind coming in and take a picture? Yeah, go.
Oh, yeah, I never asked to take pictures. I'm not good with that. Ask my kids.
But I'll take it. Or I can take them too. Oh, yeah. Oh, I thought, oh. Oh, so do you want to? I'm nervous after I never did it.
Where's your saliva bag? Yeah. I get food.
So good. Okay, I'm gonna do a few this way and I'm gonna do a few. Oh, Simba, you gotta face me. Show me your picture. Hey. There it is. Simba. Oh, he's letting her. She still has the scent all. She never wiped it off.
Yep, exactly.
Good job. Here. Let me give you the scent that I turn it. I know. It's okay. He doesn't have to be, he doesn't have to.
Yeah, I was just
Okay,
gonna.
sit. Good boy. Sit. Hey. Hey. And last. Sit, Jake, get in there, squeeze on in there. Oh, that was it. I'm sorry. Okay, I'm gonna do a couple this way. Yeah. We got it under control. Sit. Thank you. You were so pretty. You did a great job. Oh, I believe it's her. Oh, I'm so sorry.